Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Tonight's topic is choosing a chiropractor, and we're going to go through a selective process for you as the patient and consumer to make your best choice regarding chiropractic care. I've been a chiropractor for 25 years in the Somerville area, and I've seen so much change happen throughout the course of this profession, and it's very exciting. It used to be that there really wasn't, when I started out, there wasn't enough chiropractors to meet the general needs of the population at large. Now there's an abundance of good, highly qualified chiropractors in your area that can provide a tremendous amount of care and service to you. What we're going to do here today is go through a process of selection that will help you to narrow down your choices for fitting your needs and what type of care and service is important to you and the way in which it's delivered. My feeling is that sometime during the course of someone's life, they're going to need chiropractic care. Roughly about 10% of the population has seen a chiropractor at one time or another. 5% of the population utilizes regular chiropractic care because it gives them health benefits that they don't achieve when they're not getting it. And those health benefits are pain-free existence, increased mobility of the back, elimination of nerve pressure. Many times people come in for radiating pain. It's not just for back pain, but radiating nerve pain, numbness, tingling, carpal tunnel syndrome, sciatic problems, facial pains, and a whole myriad of different conditions that respond and treat well to chiropractic care. Now, one of the best ways to find a good chiropractor is to ask a good friend or family member who they might go to, and is there someone that you could refer them to for good chiropractic care? If not, and you're new to the area, you may want to consider going to the local health food stores. Local health food stores are a tremendous resource to the population at large because they know who serves up great chiropractic care in and around your area. They're talking to people all day long, people that have a natural slant, people that know when to utilize chiropractic care and who's really good in the area. Now, when you go to, there's a whole bunch of variables that go in the selective process that you go. So if you're going to call up a chiropractor and make a cold call to see where they are, see how they are and where they're located, or whether they treat your problem, you may want to look first to see, is the chiropractic care made convenient for you? Not that you necessarily have to go to the closest chiropractor to you, but you should see that it's convenient for you. And the fact that chiropractic care is very similar to like physical therapy, where sometimes the commitment to go regularly in the beginning is there, and then it tapers off as you need it less until your condition is finally resolved, and then you're discharged. So proximity to where you're living at is one factor. Another thing is that when you call that chiropractor's office, you can get a general feel from the office staff of whether they're an open, friendly staff, whether they're very amenable to your needs, whether it's an insurance-related factor, whether they can handle your insurance needs, whether they're in your particular program. Another thing to consider is the office hours. If most people were overworked, and you have to make sure that the chiropractor is open and has available hours during your non-working times. Evening hours, like we have evening hours on Monday, Wednesday, Thursday, and Friday, whether they're opened up on Saturday morning, how early they open in the morning, whether they're opened over lunch. So convenience is an issue, because if you can't get the care or it's made difficult, then you're not going to get the care that you need. Managed care has made it so that a tremendous amount of more people are availing themselves for chiropractic services because it's easy. We're in part of their plan, and insurance has covered chiropractic care for a long time, but managed care has even made it easier for people because they just have a deductible. You're going to ask the office whether they accept your insurance or whether they're part of your plan. The office will determine whether you need a referral to the chiropractor or any of those variables, whether they'll process your insurance and do all of your paperwork that might be necessary for the care and treatment. Now, chiropractic care involves the examination and treatment of not just musculoskeletal problems, but nerve-related problems, and it is a very hands-on approach and hands-on technique. So the chiropractor needs to be a skilled practitioner as far as his art and care goes, but there also needs to be a meshing of the personalities between the patient and the chiropractor. It's important that you feel comfortable and open in their presence, because a good chiropractor isn't just going to render good chiropractic care. He's going to be able to open and expand your whole world and sphere regarding natural health care, lifestyle, exercises, things that you could do to keep the chiropractor away. It's not a matter of fostering the need for chiropractic care. It's a matter of doing the best for the patient at any one given single time that you can. Now, when people come into the office, there's usually some paperwork that they fill out, and then usually they'll go into the chiropractor's office where he'll take a thorough history of the nature of the problem. Thorough history is important. If a person has imaging, MRIs, reports, it's always good for them to bring that into the office at the same time, so the doctor can take that all into consideration when they first come in. So the doctor takes a thorough history. I don't do the history in the exam room. I do it right in the office, because if from the history I don't feel that the nature, that person should be there, or that I'm going to benefit them just from the history alone, or they should be someplace else to have other forms of evaluation done before they even consider chiropractic care, I won't even go any further from that point. So this way, it's not involved. I don't think that I'm going to help you with this, and then I just send them out right now, and there's no responsibility. If it appears through the history that they're going to make a good candidate for chiropractic care, and keep in mind, chiropractic care is the #1 natural therapeutic device and #1 healing technique for the myriad of back problems. Chiropractic, #1. So from there, we would go into the exam room. We would perform an exam that includes a neurological exam, orthopedic tests, which are positions we move the patient in to check for pain. Helps us to isolate what, where, and what type of problem that they have. We palpate the spine, which means we feel the spine. A good chiropractor will always isolate the nature of your pain. And it's very important that you know that he knows what your pain is, where it's at, and that he has the ability to reproduce that pain. That is your pain. And that's one thing that I make sure that I always do, and I want to make sure that happens, because if you don't know for sure that he knows exactly where and what your problem is, that can undermine your confidence in the nature of his care and treatment. The other thing, if x-rays are necessary, we have complete imaging in the office. Not all chiropractors have imaging within their office right now, but they can easily refer out to get an x-ray done. If it's convenient to have one shop stop, then chiropractors that have an x-ray or imaging in the office, that'll be a more convenient thing. Now, not everyone that comes in to see a chiropractor is going to need spinal x-rays taken or is going to need imaging. Let's say you woke up in the morning and you got a stiff neck through sleeping on the couch, or you had an air conditioner blowing on your neck. Well, you may need an adjustment or two, or nothing involved. So imaging or x-rays of the back really aren't necessary to treat the musculoskeletal problem. If a person's had an injury to the spine or back, or they're older, or there's arthritic involvement, or they have nerve symptoms or suspicious symptoms that may be indicative of a deeper problem, the doctor is usually going to be forceful in insisting that some form of imaging, either in the forms of x-rays, MRI, CAT scan, and the likes, are ordered before rendering any treatment. So usually when a person comes in, we can do that all at one time if it's necessary. If a person needs blood work, additional referrals, orthopedic care, neurological care, any other type of thing, the chiropractor is able to refer out to these other healthcare professionals. It's really good, too, with a lot of referrals coming from family practitioners, that the family practitioners in the area also adjunctively know who the good chiropractors are. and they can either send them to you directly, because the chiropractor having a good rapport with your family physician may be essential for getting the requisite referrals that you need if your treatment is in ongoing care. Now, something that I am not big on is that I'm not big on long and protracted regimes of treatment. If treatment is indicated, chiropractic care, once again, is very similar to physical therapy. And it's important that the chiropractor and you get your goals clear on what and why you're going to see him. The way in which I work it is that, number one, if a person's coming in pain, taking them from that dysfunctional pain or eliminating the pain that they're coming in for is the most primary thing. That's what brought a person into your office. We want to see a reduction of that pain in the shortest period of time. So that can take anywhere from a few days. Sometimes it can take a week or two, depending on how dysfunctional the problem is, or whether there's disc involvement or underlying problems or diseases or disorders of the back that may influence your rate of recovery. The vast majority of patients that come in as new patients to our office just need a few treatments. So the first goal is pain reduction. The secondary goal of chiropractic care treatment is there something underlyingly that can be corrected or rehabilitated or strengthened as a result of getting chiropractic care? Sometimes it's just a matter of getting them out of pain. I'll see you. Should you need me again, we'll be here for you. Other times, the underlying problem may have been something that has been developing over a long period of time. And it is something very similar to like putting braces on, where a person may actually get, cured or corrected or stabilized from something that may have been a chronic back problem bothering them for many, many years. It's been an increasing pattern. So if there is something to correct, it's important to correct that, because if not, it's an endless cycle of pain cycle, on and on. You get you out of pain, it comes back and forth and back and forth. So we have pain reduction, number one. We have corrective phase of care, if indicated, number two. And that is usually starts as closer together and gradually diminishes as a person needs care. And then we have the supportive care, which is goal number three. That is for the chiropractor to educate things that you can do at home, meaning stretching, home and postural ergonomics, work ergonomics. That means the way in which, setting your computer upright so it doesn't bother your wrist, or setting your chairs upright, changing all of the variables that may be involved in your lifestyle. It could be a dietary issue. There could be weight problems that are involved in the reason why you have a back problem. It could be stress-oriented things. It could be the way in which you're viewing and looking at your life. It could be nutritional, psychosomatic. The chiropractor shouldn't just have his, blinders up that it's strictly the spine alone, but it could be other factors that are then influencing the spine. And you'll get a good feel for this as you have an open dialogue with your doctor. Most chiropractors are just great, thorough, wonderful. They do a great job, and they provide, and chiropractic care has built its reputation on providing good quality care that people enjoy getting. So after a person gets home instructions, there's gradually diminishing phase of care, and then they're discharged. There should always be a beginning, middle, and an end to the nature of the treatment. Or, if not, we have reached maximal chiropractic corrective value, and no further care is indicated for the nature of your condition. But should you get dysfunctional again, you can come back into the future. Maintenance or intermittent chiropractic care, not everyone gets. Some people that get that, they know when they need to come in for care, and they know the value that they get from getting intermittent chiropractic care. I'm a believer in that, but I don't push that on my patients, because my job, I feel, is to really make it so that they know when they need to come in, and when they do come in, is that it is strictly on a visit-by-visit basis. Many times there's no reason to go through any corrective care. And this then is the ultimate goal of the chiropractor, is to be effective with you, the patient, effective in correcting the problem, educate you, be there for you in the future, and be a reference source. If that, I get patients call me all the time just to ask me questions on whether it be vitamins or lifestyle, or what about this exercise, or do you think it's good for me to take Pilates, or should I avoid certain yoga positions? All of these things come into play, and that's part of an open dialogue and fostering a long-term relationship, which I want to get with my patients. I'm only going to get that long-term relationship if I'm successful in the short-term relationship. But if everything goes right, it's a winner across the board, because really it's all about people. Our business, our work, it's all about people, fostering the appropriate relationships necessary for healthy, vibrant lifestyle, pain-free, freedom of disease and disorder, and that's obviously the ultimate goal. Now, with me today is the illustrious Dr. Kenneth M. Kearstan, who works with me, and he is now going to give a little bit of further information about chiropractic care and how it can be utilized for your benefit. Dr. Kearstan.
Hello, James. Well, as Dr. Goling so well described, been choosing a chiropractor. A lot of people don't even know what chiropractic care can do for someone, or what kind of conditions it does treat. Basically, we're musculoskeletal specialists in regards that we're treating mechanical back and joint pain. Secondarily, most people want to know, what kind of qualifications do we have, or what type of history do we have in regards to being where we are. And chiropractic care, or a chiropractic physician, has to go through an extreme regimen of education and experience and internships in order to achieve a license, particularly in the state of New Jersey and nationally. A chiropractic physician has to do undergraduate education, achieve a bachelor's degree, and then go on to further postgraduate education, just as a medical doctor does. In a lot of cases, that medical doctors don't even see the amount of studies that a chiropractor does in regards to musculoskeletal issues. And we're much more qualified, actually, as opposed to a general internist. They treat more ulcers and internal conditions, and we're more skilled in treating low back pain, and musculoskeletal conditions. We actually see over 100 more hours in education in anatomy and physiology than a medical doctor does. And at the same respect, we're not as qualified as a physician or medical doctor to treat ulcers and things of that nature. So I call chiropractic care as complementary medicine. We are excellent means of a gatekeeper, in fact, where the patient can come in and we can direct them where to go to get care for specific needs. We can't fix everything, just as a medical doctor or somebody else can't fix everything. Chiropractic care is complementary medicine, and we work very closely with our physicians in the area, and we have a really good relationship, and that is the benefit you're going to achieve by seeing a chiropractor that has that type of attitude, or any physician that has that type of attitude. It drives me nuts to hear when people come in and say, my physician won't give me a referral to a chiropractor, or my chiropractor told me not to take this medication. That's terrible. It's bunk. And you should try to find somebody or a physician, whether it's a chiropractor, a medical doctor, a neurologist, what have you, that is open to different means of treatment, that their treatment is not the only and end all to their condition. So although I have the belief that I can help most people, I can't fix or correct most people or everybody. So I work very, very closely with other physicians in the area and have a large network of referral of doctors that I trust that have my same type of attitude towards making a patient feel better or getting them better in regards to getting them closer to health. And by that, what you're doing is you're instilling the patient's trust. And we're not tricking them into trust. We're just being open and honest with them. I want to treat my patient like I would like to be treated when I go and see my doctor or physician. I want to be open with them and feel that I can ask them any questions and get an honest answer. And when people come in to see us, we tell them right up front if we're going to help them or not. And if we can't help them after a certain time of objective time frame, then we go to the next mode of treatment, whether it's referral out of the office or order more testing or what have you. So it's very, very important that when you see not only a chiropractor but any other physician, that you have that trust that they are giving you their honest opinion and saying that, look, they don't just throw their hands up in the air and say, well, I can't help you. That's not an answer. There's always some means of help, whether you're helping them by referring them out or helping them right in the office. So a chiropractor, when you go into there and they're a licensed chiropractor, they are well educated. Most chiropractors these days are more open into mixing and complementary medicine. They don't just feel that the adjustment is the only means of treatment. We incorporate physical therapy modalities like electric muscle stimulation, ultrasound, things to help assist the healing process and help with the manipulation. And we're also not objective to medication. There's a time and place for everything. There's a time and place for medication, pain medication, muscle relaxants, and non-steroidal anti-inflammatories like Advil, Tylenol. It's whatever can get the patient better quicker and is more comfortable for them is where we stand in regards to, or how I stand in regards to getting the patient better. It instills their trust. They're getting better quicker, and they feel more comfortable. The key thing when a patient comes in, that when after examining them and looking at them, I have to make sure that they understand what their condition is. They have to know and understand what we're treating and why we're treating it in a time frame. By doing that, that's half the battle. That's by them understanding what we're doing, they know they're going to get better, or they know they're not going to get better, and it's an open and shut case. There's no gray zones. It's black and white. There's no mysterious protocol. What am I coming in for again? Why are you doing this? Right. Everything is up front and it's known. So by having the patient, giving them a diagnosis, telling them what they're treating, and leaving modes of other therapies or avenues of treatment is very, very important. I give them from 0 to 180 degrees of options. I say, I've seen this condition. You can either have total recovery, or we can be at this level where surgery may be an option. Usually people are somewhere in between. And that's basically, as long as you educate the patient, achieve their trust, and you trust them, let them know what their condition is, and give them actual objective time frames and goals, that's what you're looking for, and that's what you want to achieve when asking questions of the chiropractor. Can you fix this? Will I get better? Won't I get better? How can you help me? And what is their role in treating that condition and health? So by getting those main topics, you should feel comfortable in getting your treatment there with that chiropractor or physician, and it's a win-win for everybody.
And although we're not, quote, against medication in any manner, we are an over-medicated society, and that is a concern of ours, because people come into the office and things like the Advil, all the over-the-counter aspirin. I mean, people tell me they live on this stuff every single day. They're utilizing this for their neck, their back, their headaches that they get. I mean, these medicines, although they're available to you over the counter and you can use them, they are, it's not a vitamin. You don't need to take them, you're not supposed to need them to survive. Any short-term thing, that's one thing. Our goal is to correct underlying problems so that your need for that type of thing isn't there. And even after all of these years and more people are using chiropractic care, it always surprises me that I say, geez, I'm surprised, for as abundant as we are in our office with seeing patients, I'm surprised that there's not even more patients that come in to see us. Chiropractic care isn't limited to a time frame in life, meaning we treat kids, we treat athletic injuries. Many times parents will bring in their kids to have them just examined, just to make sure that they don't have a spinal problem. It's not that all young children need chiropractic care on a regular basis, but sometimes if something's not right and you give an adjustment, it's just kind of like planting a tree right. When the tree is planted right, it grows up straight. As a young child, you plant the tree in like this, and all of a sudden it grows crooked, and then you can spend your total adult life coming to me to try to straighten the redwood out when it would have been a very simple adjustment as a youth. Sometimes we treat children as young as infants because chiropractic care can treat colic effectively in 1 to 2 treatments, and it's not a vigorous form of treatment. We treat scoliotic curvatures. We treat arthritic conditions. Medicare covers chiropractic care and has since the 60s. Medicare pays for 12 chiropractic visits per calendar year. And it always is almost like, you know, like I wish I had a V8. I'm saying, I don't know why isn't every senior citizen that's on Medicare using that benefit that is, I can't see a contraindication for that person not to use that benefit that is coming to them to increase their stretching, their mobility, to get from chiropractic care everything that it can. We talk about a pound of prevention, an ounce of prevention being a pound of cure. Well, here, as a senior, you have the resources that the government has provided for you as on almost an as-needed basis. Once a month, you can get what your needs are. And I'm just surprised with the number of older people that don't take advantage of that. I think that they may be frail, or you know, that the chiropractor is going to rough them up or apply too much pressure, and you know.
We're talking about treating different people in different age groups and things. A chiropractor doesn't do one type of adjustment. There's different levels of manipulation and intensity and treatment. When we treat people that are seniors or are osteoporotic and have severe arthritis or severe osteoporosis, there's different, we're not going to be doing aggressive manipulation to their spine. We're going to be doing things more like traction, intersegmental traction, stretching, soft tissue work. Same with infants. And when we talk about or babies, you hear, you know, people afraid of, you know, we're not manipulating cervical spines. We're doing more pressure point therapy, more massage. Physical therapists are very skilled at this in regards to treating babies and colics, and in chiropractors. In the same time, there are now chiropractors are becoming on staff in certain hospitals in the NICU wards because they're treating babies that have unexplained colic and gas problems, but by hitting certain areas in a certain area of the spine, massage and soft tissue, it helps alleviate that. So we're not, you know, wailing on everybody, like we said. We're not just adjusting and manipulating people and not having a purpose. There's different degrees of manipulation and treatment. There's even certain other types of tools that are used, things called activators or small mechanical things that do small manipulations, tables that are movable, have drop pieces. So there's a variety of types of manipulation, which is also something that a patient might want to ask if they're used to a chiropractor adjusting them a certain way. We try to accommodate that too. Right. We don't just have one type of way of treating. There's many different ways, you know, to treat a patient, and some people respond better to certain ways of manipulation than other people.
You know, the big thing is nowadays is that, you know, MRIs are great and CAT scans are great. They allow for us to see the soft tissue of the spine. Don't think that just because you have a disc condition in your back or neck that the chiropractor isn't necessarily equipped to be able to handle your condition. We see bulging discs, herniated discs. There are times in which the clarity of those tests, let us know when we can help that person right from the get-go. So it's wonderful, but don't think that, you know, anytime you hear the word disc that it means surgery or it means not, you know, naturally oriented.
And that's a problem with certain people that.
For natural health care alternatives. Dr. James R. Golding, Dr. Kearstan, thank you for coming today.
Sure, thanks.
Please consider the utilization of this treatment.